Hello and welcome to All You Need to Know About Healthshare Programs. In this brief webinar, we'll review Healthshare programs and compare how they measure up to current Obamacare health insurance options. Let's get started. So first, for those of you who may be unfamiliar with the Healthshare concept, Healthshares are organizations that facilitate sharing of healthcare costs among their members who have common ethical or religious beliefs. Healthshares are not health insurance. These are groups of like-minded people who band together to share medical expenses in a mutually beneficial way. Contrary to what some might think, the Healthshare concept is not a new phenomenon. Healthshares have been protecting their members from financial catastrophe for over 30 years. But they have gained in popularity over the last several years due to the skyrocketing cost of health insurance under Obamacare. In 2017, we saw rate increases of up to 120% in some areas of the country. And in 2018, rates are expected to continue to skyrocket as well. This has created a huge demand for lower-cost alternatives to healthcare. Today, there are over 1 million hardworking Americans who have become members of Healthshare programs, and these Healthshares have paid out over $1.5 billion in sharing needs. It's coverage you can count on and afford. You see, Healthshares are considerably less expensive than Obamacare health insurance plans, unless you're in that small group of people who are receiving large government subsidies to offset their monthly cost. And they exempt you from Obamacare tax penalties. Another strength to Healthshares is that they utilize their own in-house price negotiation teams, working hard negotiating pricing with your doctors. They also give you access to bigger provider networks, leveraging the power and flexibility of PPO networks. You see, PPO networks used to be the golden standard of doctor-provider networks before the shift to limited HMO networks under Obamacare. With a PPO, you see who you want, when you want, in or out of network, and have access to doctors all across the nation. Lastly, we find that many of our clients are attracted to Healthshare programs because they don't force you to pay for things that you don't want or things that you are ethically or morally opposed to, like contraception or abortions, or substance abuse treatment. As I mentioned previously, Healthshares are not health insurance. And to not confuse the two, they have their own terminology, as you can see from this slide. While Healthshares are not health insurance, they do accomplish the same end goal and serve the same purpose. Unlike health insurance, Healthshare programs do require that you agree to certain beliefs. As an example, we'll take a look at ALERA's required statement of beliefs. We believe that our personal rights and liberties originate from God and are bestowed on us by God. We believe every individual has a fundamental religious right to worship God in his or her own way. We believe it is our moral and ethical obligation to assist our fellow man when they are in need according to our available resources and opportunity. We believe it is our spiritual duty to God and our ethical duty to others to maintain a healthy lifestyle and avoid foods, behaviors, or habits that produce sickness or disease to ourselves or others. And lastly, we believe that it is our fundamental right of conscience to direct our own health care in consultation with physicians, family, or other valued advisors. Healthshares are a perfect fit for those who lead a healthy, clean lifestyle. Healthshares do require a review of your health history in order to qualify for the coverage. This process is similar to how things were done before Obamacare. So there can be a look-back period on certain pre-existing conditions as well as waiting periods on certain services. As a general rule, being a tobacco user is a disqualifier with Healthshare programs. But there is a terrific option for tobacco users who are interested in quitting that will cover you for a year in good faith and work with you hand in hand to kick the habit. Now let's look at the major differences between Healthshare programs and ACA or Obamacare health insurance plans. Under Healthshare programs, preventive care is not free and varies by Healthshare. There's also no cancer coverage for the first 12 months. Healthshares do not share for mental health or alcohol and drug abuse treatment. Some Healthshares have annual and lifetime maximum sharing caps. Also, certain pre-existing conditions may make you ineligible for certain Healthshares, or a limitation may be placed on a certain condition. As I mentioned earlier, Healthshares leverage the strength and flexibility of PPO networks, so their members have control over how and where they receive their care. Another great strength of Healthshare programs is that they're much less expensive than Obamacare health insurance options. The national average for an ACA Silver plan for a family of 4, husband and wife age 50 with 2 kids, is over $1,300 a month and has a max out of pocket of over $13,000 a year. Under AleraCare, that same family could be covered under one of their premium health shares with a $5,000 MSRA for only $789 a month. Over the course of a year, that family could save over $6,000. Just consider those savings. So let's recap. Health shares are a tried and true low-cost alternative to health insurance, where groups of like-minded people band together to share medical expenses in a mutually beneficial way. Health shares are exempt from the ACA tax penalties. There's no enrollment period, so you can enroll any time of the year. Health shares are a stable, long-term solution to health care. No more switching plans every year. Health share programs are ideal for health-conscious individuals and families. You must qualify for health shares, and pre-existing conditions are not covered. With some health shares, there may be waiting periods on certain benefits, and no cancer coverage for the first 12 months with most health shares. And the best thing about health shares is that you can enroll at any time, so you don't have to wait until open enrollment to change plans. So if you're healthy and currently have an overpriced ACA plan draining your wallet or pocketbook with deductibles and out-of-pocket costs too high to even use the coverage, imagine having a plan that met your needs that could save you $400 to $500 a month or more. What could you do with all that extra cash? I'm sure you could find a better investment or use for it than to give it to an insurance company every month. There's no time like the present to start saving money. That concludes our webinar. If you're ready to take the first step towards saving yourself hundreds of dollars a month, reach out to us now.